Every year, thousands of people are newly diagnosed with colorectal cancer. While this condition can feel frightening to talk about, awareness is one of the most powerful tools we have. Recognizing potential warning signs early and understanding how lifestyle choices affect our long-term health can make a significant difference. This video is not meant to scare you, but to inform you. Because the earlier people notice changes in their body and seek professional advice, the better their chances of addressing health issues in time. Today, we will go through the most important symptoms that may indicate problems with your colon and also highlight preventive steps that support long-term gut health. How common is colorectal cancer? Colorectal cancer is one of the most frequently diagnosed cancers worldwide. In some countries, it is the second most common form in women and the third in men. Risk increases with age, and genetics also play a role. Having close relatives who developed colorectal cancer can elevate personal risk. But while genetics and age are factors we cannot change, there are many lifestyle choices we can influence, and that is where prevention begins. Early warning signs you should know. The tricky part about colorectal cancer is that symptoms can be very subtle in the beginning, or even absent. Still, there are several changes that may serve as red flags worth discussing with a healthcare professional. 1. Changes in bowel habits. One of the earliest potential indicators is a noticeable shift in bowel habits. This could mean persistent diarrhea, frequent constipation, a feeling that your bowel does not empty completely, changes in the consistency, frequency, or even the color of stool. What matters most here is not a single episode, but ongoing changes that last for weeks. Occasional irregularities happen to everyone, often due to stress, diet, or minor infections. But if something feels persistently different without clear explanation, it's important to have it checked. 2. Blood in stool. Another potential warning sign is the appearance of blood in the stool or on toilet paper. The blood may appear bright red or darker. While blood can result from benign issues like hemorrhoids or fissures, it is always worth medical attention. Only a proper examination can determine the cause, and it should never be ignored. 3. Abdominal pain or discomfort. Persistent abdominal pain, bloating, or cramping can also indicate that something is wrong. Again, occasional stomach aches are common and usually harmless, but repeated or long-lasting discomfort, especially if unexplained, should be taken seriously. More advanced warning signs? When colorectal cancer progresses, the symptoms can become more pronounced. Being aware of these helps people seek medical help before complications occur. 4. Unintentional weight loss. Losing more than 10% of body weight within 6 months without trying is considered a warning sign for several health issues, including cancers. If the body cannot properly absorb nutrients, unexplained weight loss may occur. This is always a reason to consult a doctor. 5. Persistent fatigue and weakness. Extreme tiredness that does not improve with rest can sometimes be linked to iron deficiency caused by chronic internal bleeding. While fatigue is common in everyday life, especially due to stress or lack of sleep, the kind of weakness that interferes with daily activities is different and concerning. 6. Symptoms of bowel obstruction. In very advanced cases, a blockage of the intestine can occur. This leads to severe abdominal pain, bloating, nausea, and vomiting. A bowel obstruction is a medical emergency that requires immediate treatment. Prevention and lifestyle measures. Although no one can guarantee full protection, there are well-researched lifestyle factors that can lower risk and strengthen overall gut health. Regular screenings. Colonoscopies are among the most reliable ways to detect polyps or abnormal growths early. Depending on your age, family history, and doctor's recommendations, preventive screening can be a life-saving step. Balanced nutrition. Nutrition plays a key role in maintaining a healthy colon. Some helpful habits include high-fiber foods, whole grains, legumes, fruits, and vegetables support regular bowel movements and nourish beneficial gut bacteria. Probiotic foods, yogurt with live cultures, kefir, sauerkraut, kimchi, or other fermented foods may help maintain a balanced gut flora. Prebiotic foods, bananas, onions, garlic, asparagus, and leeks provide nourishment for beneficial bacteria in the intestines. Limit processed meats and excess red meat, these are associated with a higher risk when consumed frequently. Moderation with alcohol and sugar, both can negatively influence gut health when overconsumed. Physical activity. Regular exercise not only keeps your weight balanced but also improves metabolism and overall digestive health. Aim for at least moderate activity several times a week. Avoid smoking and excessive alcohol. Both smoking and heavy alcohol consumption are associated with higher risks for various cancers, including colorectal cancer. Reducing or avoiding them is a powerful prevention step. Maintain a healthy weight. Obesity is a known risk factor for colorectal cancer. Sustainable weight management through healthy eating and regular activity can reduce the risk significantly. Let us recap. Watch for persistent changes in bowel habits. Pay attention to blood in the stool. Take ongoing abdominal pain seriously. Be aware of unexplained weight loss and constant fatigue. Do not ignore severe symptoms like bowel obstruction. And most importantly, focus on prevention, regular screenings, a fiber-rich diet with pre- and probiotic foods, physical activity, and a balanced lifestyle are keys to reducing risk. Awareness can truly save lives. Being proactive about your health means noticing changes early and taking them seriously, without panic but with responsibility. So, if you found this video helpful, remember, awareness and prevention start with small steps every day. Share this information with your loved ones, because together, we can create more awareness for gut health. And if you enjoyed this video, feel free to give it a like and subscribe to my channel so you won't miss anything in the future. Thank you. And at end, please notice. This video is for informational purposes only. It does not replace a personal consultation, examination, or diagnosis by a licensed and qualified physician. In particular, for any questions regarding medications, always consult your doctor and follow the instructions in the package leaflet. The information provided cannot and must not be used for making independent diagnoses. Liability is excluded.